In today's video, we're going to go over long head bicep tendinopathy, whether that's tendonitis or tenosynovitis, right here in this portion of your shoulder. Now, the bicep, known as the bicep brachii, there's different components to the upper arm. There's the brachialis that's under here, there's the brachioradialis, the coracobrachialis, and the biceps brachii that's right here. So this has two heads, right? Hence the word bi, right? So it's two, it's a short head and a long head. The long head, its tendon travels up the outer portion of the arm here, goes through a groove in the upper arm bone known as the humerus, and this groove is called the intertubercular groove. It's held in place down in this groove by a portion of kind of the labrum, some of the fibrocartilage. It's called the transverse humeral ligament. And so it sits in this groove, the intertubercular groove. The transverse humeral ligament sits across it, holds it in that groove. There is a sheath within the groove as well, almost like a piece of pipe. And the tendon travels through the pipe and it slides back and forth through the pipe. Inside that pipe, it's going to be lubricated with some synovial fluid. So it keeps it lubricated so it slides nice and easy. So this can become inflamed and irritated, especially in cases where the arm has been forcefully pulled back or you've been doing a lot of overhead work. You can irritate it under this, what's known as the subacromial arch here. I have a lot of baseball players that get injured here. This becomes irritated because of the movement of throwing, with the arm and overhead motion. So there's a bunch of different reasons that this can happen. And so when it does happen, the question is, what do you do about it? Right? Do I just rest it? And of course, this is always, you want to talk to your doctor and, see what you need to do. My videos for entertainment purposes only. However, I'm going to show you kind of some of the techniques that I would do to slowly reintroduce load and exercise back into that tendon and muscle in order to return back to function. So I'm going to show you a little bit here. This is the long head bicep tendon here as it travels through the upper arm. So you see I have my model here, and so this is the long head bicep tendon as it travels into the shoulder joint. And so this area, again, like I said, can become irritated very, very easily. And once it becomes irritated, sometimes it stays like that for a long time, especially if you don't go through proper loading techniques. Now, something you need to remember is it's normal and okay while you go through exercises in this area or any area that you're having a tendinopathy that you're going to have some pain increases. That's okay in most cases. In other words, if your pain is a 4 out of 10 when you start, you go through your exercises, it's a 7 out of 10. You stop the exercises, and usually I tell my patients within an hour or two, that pain drops back down to a 4, then we're okay. If it stays up and doesn't go down, we did a little too much, I like to back off. Now that's just my personal preference. And so again, just remember, you're not going to be pain-free right away. You're going to have some discomfort and pain during this process, but at the end of the process, you stand a better chance of having better scar formation, better return of motor control and strength, and then overall better functional use of your arm and hand. One of my favorite techniques when a patient's having shoulder pain is distraction stretches. So I'm going to use this piece of PVC pipe here. You can use a broom handle or a cane, kind of whatever you have. I had patients use baseball and softball bats, hockey sticks, whatever. So you're just going to take this out on the end, and I'm pushing with my left arm. I'm pushing my arm and hand straight away from my body. So I'm pushing this, and I'm going to hold it, somewhere maybe 10, 15 seconds. If it's too uncomfortable for you to bring your arm up that high, that's fine. I've had patients just start down here at the bottom, and I'm pushing down towards the floor. Again, this is just a really good stretch. Just really feels nice to, kind of open up some of this tissue and structure in here. So I start off doing that, and I would do that at some point either before my exercises or after my exercises that I'm going to do with my patient. One of the things I like to incorporate with my patients' programs is some type of manual therapy. Now, it's very difficult to perform manual therapy or hands-on techniques to yourself. So I recommend one of these small massage guns. It's a percussive massage gun. It's a Bob and Brad brand. You can go to my website, ChadGOrthoOT.com. Go to my Amazon favorites. There's a link for this. This is a really nice massage gun. It has a bunch of different heads on the end that come off nice and easy. And also, the other thing is it's very lightweight. It's very, very quiet. And I've had some of these that are really loud. And so anyway, you just take this and you're going to run it up and down all over the bicep, all around the shoulder. And you have to be careful on some of the bony spots of the shoulder, the AC joint and all that can be a little tender. But I'm just going to go all around kind of trying to increase my blood flow to the area, improve primarily that kinesthetic awareness that we lose. That's, a lot of times we have an injury, we lose some of this kinesthetic awareness, and so it's also known as cortical smudging. So we're going to try to improve that, kind of bring some awareness to the area. Plus it feels good just to have that, that massager run on there. So we're going to do that technique, and then I have patients either do this at the time of all their exercises or at the end. Doesn't really matter that much to me what you do at home. I like to do something like this before my patient goes through their exercises because of that kinesthetic awareness I'm trying to bring to the tissue, kind of making that mind-muscle connection, so to speak. But again, some people go through all your exercises, all this strenuous stuff, and then do the feel-good stuff afterwards. And so it's just really preference as to what you want to do and what you like. But again, that's the Bob and Brad massager, and I definitely would use that for a few minutes every day, several times a day on this irritated area. Now we're going to start our strengthening exercises. So I have one of these exercise bands. I'm just going to stand on it with both of my feet, and I've got a hold of it here, my palms facing forwards. And as I hold this, I'm just going to statically hold this. And I'm not going to curl it. I'm just going to hold it so that there's tension. You want a band that's strong enough to where you have some tension here that you're putting on the bicep, and I just have my patients statically hold this. And if this is uncomfortable, they can rotate the palms inward a little if they need to, or go palm up, whatever feels the best. So I'm just going to hold this for 5 to 10 seconds. I'm going to relax. And then I'm going to go back in again, 5 to 10 seconds. I'm going to hold it, and then I relax. And I have my patients start off with one set of 10 to 12 repetitions with that initially. Now we're going to progress that exercise. We will do the first exercise for a day or two, and then I'm going to start progressing into these 3 position static holds. So what I'm going to do is I'm going to start here where I started in that first exercise. I'm just holding it, and I would do maybe 3 seconds, and then I bring it up, and then I hold it here, kind of parallel here to the floor for about 3 seconds, and then I bring it all the way up, and I'm going to hold it here about 3 seconds, and then I come all the way back down. Now that's pretty strenuous, and I usually have my patients only repeat that maybe for 3 or 4 repetitions because it can really irritate things. If it irritates a shoulder too much to go all the way to the top, I might have them just stop right here and not go all the way up. But I start with that first exercise for a day, maybe 2 days, and then I start having them add in this movement on top of that movement. So after we're done those first 2 exercises, maybe for the first week, then I'm going to start adding dumbbells in. And so I'm going to take a light dumbbell, just something I can control. This is where a lot of people mess up. They go back in the gym, get heavy dumbbells instead of taking something light, because remember, you're probably still pretty strong. It just may hurt. So we're not concerned right now so much about the strength as I am to try to put the tendon under a load, under tension for proper scar formation. So I'm going to start my palms facing together, right? And then as I come up, I'm going to rotate or supinate my palms upwards, because this bicep brachial muscle, what it does is not only does it flex the elbow, right, brings my hand towards my shoulder, it also supinates my forearm. So if my forearm is in, let's just say, neutral position, when that bicep contracts, it flips my hand palm up. So if it's too uncomfortable to start with palms facing each other when you do that, I'll have my patients just have their palms both face forwards and just start with this. And maybe I would do that for a couple of days, for 3 sets of 10 to 12 repetitions, and then progress into combining both the supination with elbow flexion. And I would do this exercise in conjunction with the other 2 band exercises that I'm doing once a day on a daily basis for usually maybe a week to 2 weeks, and then I'm going to transition out of that. But during this time frame, I'm also going to show you one more exercise that I would incorporate to go along with what you're already doing. So I would have my patients perform the first 2 band exercises that I showed you, and then add in these dumbbell curls, and we're going to do that for the first 2 weeks on a daily basis. As you begin to tolerate it, as it feels better, you may can do that twice a day. We don't want to overdo it, but you can do it once, twice a day. I've even had patients do it 3 times a day, especially if they're using lower resistance levels. And now I'm going to show you the next phase of what I would go into for recovery for this issue. Now we're going to take the dumbbells, right? We're already performing those same 2 band exercises. We already are performing our bicep curl exercises with our dumbbells. And now we're going to do what I call shoulder scaptions. So not right here in the front, not straight out to the side, what's known as the scapular plane. So kind of out here, almost like the, I'm making a Y, with my arms if I go up higher. And initially I would just do this to shoulder level. And as my pain, permitted, I would go higher. If you go higher, again, you could take that tendon underneath that subacromial arch and irritate it a little bit. So I just go to shoulder level and then back down, nice, slow, and controlled. And I would complete 2 to 3 sets of 10 to 12 repetitions. Now the reason that I'm doing that movement is because the long head bicep tendon crosses the shoulder joint. So not only does it flex the elbow, supinate the forearm, but it also, its secondary motion or job is to flex or elevate the shoulder, or the humerus as it articulates on the scapula. So again, I'm doing those other exercises already. I'm adding this exercise in after the first 2 weeks. It's not written in stone. That's typically what I would do. And I'm going to start adding this in. And now I have 2 more exercises that I want to show you that we're going to add in on week 2. Band shoulder external rotation. So I'm going to bring both elbows by my side. You can just use one arm with this and fasten the other side of a lot of these bands to the door, to anchors. I like to have my patients do both sides just because I like to work both sides. And so elbows in, palms kind of straight out in front. I'm at about a right angle here, give or take. And I'm just going to pull this apart. Nice and slow. Pull it apart. 2 to 3 sets, 10 to 12 repetitions. Really feeling that on the back portion of my shoulder, because if we strengthen the rotator cuff muscles, that can help support this bicep tendon and the functioning that it's performing during movement in space. The last exercise that I'm going to do is a band internal rotation for the shoulder. So I have my band over here attached to these dumbbells on the table. Hopefully they don't fall off. I recommend you fastening this to an appropriate structure, whether it's one of those anchors around the doorknob or whatever. But elbow by my side. My elbow is also bent to 90 here, or my forearm is bent to 90. And I'm just going to go right here, bringing my hand in towards my stomach. And I would do 2 to 3 sets of this for 10 to 12 repetitions. And then again, we're going to continue with that external rotation with a band. We're going to continue with that scaption movement with the dumbbells. We're also going to be doing dumbbell curls, working on palms facing each other, rotating while we come up. And then, of course, those isometric band exercises. I still like to incorporate those into the movement. It doesn't really matter the order. So by the time that we are in this, let's say 3 weeks. So first couple of weeks, we're just doing those 2 band exercises, and then we're adding in, after that, the dumbbell curls, the scaption movement, as well as the internal and external rotation movement. And so I like to just kind of slowly progress this whole process over about 4 weeks. Some patients take longer, some patients less, but I'm going to kind of combine this together. It doesn't really matter to me the order that you do any of this in, just whatever feels best to you and what you have time for. Thanks so much for watching this video, guys. I hope that it helps. Remember, you're going to start this program for your bicep in phases. You're going to start with those bands and then progress to the next phase. Usually, I stay in phase 1 for the first week or so, maybe even 2 weeks, and then I'm going to progress to phase 2, and then I just kind of go from there. And usually, after my patient is being in for about 4 weeks, depending on how they feel, then I will go into heavier things like exercise machines, heavier dumbbells, barbells, all those types of things at that point. The biggest thing you need to remember with this is it's not uncommon to have pain while you go through your exercises or movements. A lot of people think if they have pain when they perform the exercise, they don't want to do it, and it's uncomfortable. Just remember that the pain with a tendinopathy issue or tendinitis is very, very normal as long as it calms back down after you stop the movement or the exercise that you're doing. So again, I hope this video helps, guys. Make sure you hit that subscribe button, and thanks so much.